Ms. Mayor, why don't you manage this portion of the meeting?
Sure. So just about everybody has a question. So first, Mr. Frisch, and then Ms. Sizemore-Heiser.
Thank you. I want to thank staff for all the work that they've been doing on this, and for noting that we all have a personal stake in this. Some of us have partners who teach. Some of us have children in our schools, and I speak for the school board. We visit dozens of schools every single week, so we have a personal stake in this. I'm grateful that we're guided by science in this and that we're working closely with our public health experts to make sure that we're following best practices and that we're aligned on these issues. I would note that we have a lot of first responders in this situation. Our teachers, who are being asked to go above and beyond when it comes to making sure that students are following best practices for washing their hands and staying clean. Our custodians, who are being reminded about best practices and potentially having to disinfect schools to an additional level. Our cafeteria workers, who are being pushed to make sure that we're following the best standards there. And our bus drivers, as was explained in the presentation, who are learning new ways to make sure that the buses are staying clean and that students are not being needlessly subjected to certain issues. So I hope that this conversation eventually guides us in a discussion about the way that we compensate these extremely important people who would make dealing with this issue far more difficult were they not there. Some questions I wanted to get out, and then I'll let staff respond. During our school board meeting last week, our student school board member raised the issue of bullying and whatnot directed at primarily students of Asian descent around the virus. I'd like to know what the school division is doing to address this issue on a school-by-school basis. I know that the federal government has allocated $8 billion for the CVID response. I'd like to know if there is any aspect of that that includes money for the response by school divisions, and more broadly, if our lobbying folks are focused on being part of the conversation about getting money from the state or the feds. I'd like to know what approach we have for making sure that we're in the mix on getting that money. And I'd like to know who is classified as an hourly employee. Some businesses have moved towards expanding who is typically available or will typically get paid leave to part-time employees who are not generally accepted as getting those benefits. I'd like to know who we exclude from administrative leave. Thank you.
Yeah, so with regard to the $8 billion, we're looking to see what provisions are in that federal grouping of dollars to see where schools fit within that. I know that as we think about Fairfax County Public Schools and any needs that we might have, our board currently has an $8 million set aside in terms of a reserve. And if there would be any additional needs, we would, of course, work with our school board to identify funding from our flexibility reserve to support some of the aspects of our plan. One of the pieces that we did discuss was the administrative leave for all of our employees. When we're talking about our hourly employees, we tried to create a grouping of employees that would be as all-inclusive as possible. And so it's essentially providing coverage for all of our employees except those who might work in an hourly capacity within our offices or buildings that are not contracted hourly. Our contracted hourly are our custodians and our food service workers and our parent liaisons. But again, those individuals who have no rights to leave, no rights to administrative leave, no rights to benefits would be our straight hourly individuals. And so we haven't provided or afforded that to those individuals. But everyone else where we have we would expect you to be at school and would expect you to work, then we are going to provide you that leave. I know that Dr. Presidio wanted to talk a bit about stigma and what we're doing to support our schools with regard to the stigma.
Just real briefly, I mean, we did have the opportunity last week to convene a meeting with all of the division school principals, and this is one of the issues that we discussed. We've released information and language to make sure that our schools are looking at issues of bullying, harassment, stigma as it pertains to the coronavirus. We've got very explicit language about making sure that we're not being culturally insensitive when thinking about a student's or a family's ethnicity with regard to the coronavirus. I know that some of that information, I mean, you mentioned we all have a personal stake in this. I have 2 children in FCPS, and my wife teaches in FCPS. And both my wife and my children told me that that information had at least been relayed back to them through the school system as of last week. So I think our principals are taking it very seriously, and our counselors are supporting our principals, our teachers, and our students in that regard.
And I do want to say, Mr. Frisch, that with regard to those dollars, most of our federal dollars are pushed out through the state and through VDOE. So as we have communications with VDOE, we'll be asking about any additional funds that might be coming from the federal government.
Ms. Sizemore-Heismer, followed by Ms. Cohen.
Thank you very much. I have a few questions. So I'm just going to ask a question and give you some time to respond before asking the next one, if that's all right, because I know it's a lot at you. The first question on slide 2, you talked about teachers instructed to provide time for hand washing or sanitizing. Is there instructions for the students at the secondary school level? I know a lot of families and students feel like there's not even enough time during passing period for them to use the restroom, much less walk into the restrooms, and there's some restrooms who may or may not have soap. Is there any way we can put hand sanitizer, I don't know, kiosk isn't the right word, up as kids are walking through the hallway to be able to at least grab some hand sanitizer? But I know, I'm just curious how this applies at the secondary level.
So we've talked about that. We've talked about some of the challenges at our secondary level of students who who couldn't possibly wash their hands because they're more important. It's more important to be on your phone than wash your hands. And of course, our principals have talked about that. We reiterated very strongly at our all county principals meeting the importance of hand washing, hand sanitizing, and as Mr. Plattenberg shared with the group, that we have ordered additional bottles of hand sanitizer for our schools. We don't have the kiosks at this point, but it's certainly a conversation that we can have and plan to have with our secondary principals. And I don't know if, Jeff, you want to share anything more about hand sanitation.
Well, just once again, you know, that what we do have currently in stock are hand sanitizer wipes, but the reality is, has been stressed by the health director and all the medical professionals, the real significant responsiveness, the most effective is washing of the hands. So we have really taken an extra step to reiterate that, to articulate that. In fact, as Mr. Smith mentioned, during our last principals meeting, we had gone ahead and reiterated some of the communications around that. But yeah, we will be delivering, we will be getting a lot more, we have them on order, like over 10,000 units. But again, like with everything else, it's back ordered because everybody's trying to get more.
Thank you. Just one suggestion, perhaps, to reach out to our secondary school principals and let a little leeway on tardiness to encourage our students to stop and wash their hands in between those passing periods might be a way to alleviate that. I appreciate what Carl brought up about the misinformation regarding race and about making sure that we're as expansive as possible in terms of that admin leave, so I'm not going to touch on those pieces of it. I did have a question also on slide 6 regarding the proactive closures. Just to say that we do have precedent for closing just 1 or 2 schools when we've had power outages and things like that. But I wanted to know, when we're talking about proactive closures, I want to make sure that when we're looking at division-wide closures, it sounded to me like it's kind of a reactive measure to there's a certain number of students and staff that are going to be out, and that's why we're looking at division-wide closure, as well as guidance from our health department. But is there plans for a more proactive closure at the scenario 2 level using snow days or other means? Those are some questions I'm getting from the community. So just a question on, is there something that'll trigger more than a lot of students and staff out, or the health department?
So again, as we look at that scenario 1, where we talk about one school or a grouping of schools, if we were to look at containment for the entire county, and if that was the direction from the health department, we would look at and using that containment scenario as a means to close schools. So when we talk about scenarios 1 and 2, we also can look at different hybrid approaches to how we might approach this. We really want to look at scenario one, being focused on what you would do if you close individual schools, but we have business as usual. Scenario two is looking at whole school and whole county closures. I shared that one was more focused on containment, the other on mitigation, but you could have the second scenario be a containment scenario as well.
Thank you. And then additional question, I appreciate you mentioning students with disabilities and English language learners. I know a lot of us share concerns about how are we going to support sort of the breadth of our families and student learner needs. You mentioned having 1 or 2 days potentially for teachers to prepare for having a broader closure. I'm wondering if there's a piece that we can also have sort of virtual family preparation and student preparation in terms of virtual lessons or using our Parent Resource Center to allow for training on how to support your student in a virtual learning environment, some support for our students on how to do that, as well as making sure that our English language learners and our students with disabilities needs are being met. But I just wonder if there's pieces for that in there as well.
And those are things that we could certainly look at. I know that as we think about how we support our families, the Parent Resource Center is a great option for supporting our parents, and would want to ensure that either through video or other kinds of updates that we could provide that kind of instruction. The other piece, and one of the luxuries that we have in Fairfax County, is our Red Apple 21. And so as we think about our programming on Red Apple 21, we've actually had some discussions about how we would utilize that cable channel to push information out to our community, possibly set up different times for certain instructional opportunities to be shared via the cable cast. So there are opportunities there for us to also push a lot of information out that wouldn't necessarily be online, but would be through a venue that many of our families have through cable, and can also access that on their phones.
Thank you. I just wanted to be mindful of making sure that what we're pushing out isn't just information we've already had, but really being mindful of this is a unique situation for our families where they're not used to supporting students to maybe potentially to this level of learning where you're learning everything at home. And so to sort of be mindful of that as information we put out. A couple other things. I really appreciate all of this. The work groups you've mentioned in terms of preparing for this, I want to make sure that in instruction you're having intentional work groups around supporting special ed students, English language learners. So it's not just instruction as a whole, but these special groups. And then the other part is when you talk about phase one, a plan for phase two to help teachers catch up for students from phase one who may not be as adept at self-learning in phase one as other students might be. Those are my last two questions or points.
Yeah, again, great points, and we appreciate the suggestions. We have been, as I said, meeting since February to work on the distance learning plan, and that does contain members from both the English Language Learner Services Program and the Department of Special Services. So it's a very integrated, holistic approach, as well as counseling services.
Okay, just a time check. We had originally planned to close the discussion now, but we'll extend it to 12:25 if there's agreement among the board. Yes? Okay. Yep, so, yeah, thank you, everyone, for the input. Yes, Ms. Gamara? Well, yeah, I have a list. Next speaking is Ms. Cohen, and then followed by Dr. Anderson.
I just was asking for clarification. You mean 12:25, everybody stops talking?
Well, that was our goal.
I guess we,
Can you just hold on for one, excuse me, can you just hold on for 1 minute?
What I would suggest is that let's go till 12, see where we're at 12:25, and do an additional, let's see where we're at 12:25, and we can take the pulse then. But please be succinct in your questions so that we can continue forward.
Every board member.
Yes.
Excuse me, so next is Ms. Cohen, followed by Dr. Anderson.
Thank you. I want to echo again, we really appreciate all the work you all are doing. I know this is uncharted territory for all of us, so we appreciate your patience with us as well. My first question is about thresholds for the single or small. Do you all have in mind guidance from the health department about what's a threshold that would cause a single closure?
So there are two different scenarios. So you have the threshold in terms of the number of individuals who might be ill if we see that there are absences within a school. But for scenario one, that threshold would be if there was an individual who was infected who had contact with with our schools, we would close that school to engage in some type of deep cleaning activity. And then based on the recommendations from the health department, reopen school, and we'd like to do that in a very quick turnaround. I wouldn't want to say that that would be one day. I wouldn't want to say that it would be 2 days. It really is based upon the contact investigation that the health department does. So if you have an individual who has contact with our schools who is infected and has traveled through the entire building, then of course we would want to make sure that we would take the time to do that and do that well. If they noted that the individual was in the front office and stayed in the front office primarily, then of course we would enact cleaning protocols. So the threshold is contact from one individual who has the virus. We would then close schools to clean.
Thank you. My next question was with the sub shortage that we have already, are we seeing anything, a decline in people picking up jobs in our schools now?
I haven't noted that. We can certainly provide an answer to the board. Normally, I hear about sub shortages from Sean McDonald, who is our Director of Talent and Acquisition and Management. I haven't heard that as of yet. It seems that our jobs are still being taken as they regularly would be, but we can share that information with the board.
My next question was, I think you all have probably heard the same thing we've heard of parents and teachers who've expressed that we have 17 days that we haven't had to use for weather-related closures. So I think they have concerns over why would we not use that period before we start talking about distance learning where we're requiring graded activities and required work.
So I think that's a really important discussion for the board to have. The distance learning plan that we've been putting together is to be prepared if we need to resume instruction in the short term. But certainly the board, in conversation with the superintendent, could adjust these phases and these timelines that we've shared with the board. But this is the work that we're doing if we want to really make sure that we're being responsible and proactive to get school open as soon as we could.
And my final question was just about the food distribution. I would just encourage you that I hope you will partner with some of our organizations. We have Food for Neighbors that's already working in some of our schools, and then the community partners and faith groups that are already really actively involved in our community to help with food distribution, should we ever get to that. Thank you again.
Okay, Dr. Anderson, followed by Ms. Tolan.
Thank you. I have 4 questions, and hopefully they'll all be short with great answers. The first question is regarding communication. I hear the plan here. I hear that it's going to be on the website, et cetera, and sent out to parents. But I really want to make sure that we're reaching some of our parents who don't necessarily access those avenues. How are we working, or are we thinking about working with our PTAs, our PTOs, our parent liaisons to make sure that the word really gets out regarding what is happening? In addition, what languages will this be translated in to make sure, again, that we're reaching everyone who is impacted by this calamity? And lastly, on this point is, are we also going to use the phone messages to get this out to parents, even if it's just to lead them to the website and offering that in multiple languages as well? Because sometimes it's very effective just to get that phone call. So that's question 1.
Oh, that's question 1. Okay. So with question 1, communications, so yes, as we think about the work groups, and we've already had communique from the FCC PTA and working with our community stakeholders and helping us with that languaging and getting that message out. With regard to translations, our website is currently translated into 8 different languages, and so we would certainly continue with those online translations and work with our parent liaisons who might need information translated as they're working with our individual communities, because again, we utilize them. They are our another front line. We have many front lines in Fairfax County, but they are our front line for those families who don't normally interact with the schools. And in terms of the phone messages, that is an excellent suggestion. I know that we are utilizing all of our communication channels to get information out to families. The one thing that we're trying to do, and this is, again, working very closely with the health department, is trying to balance our response to overall community fear and not wanting to push people into a sense of fear or chaos. So again, we are working very closely with them, and so we're trying to make sure that we're providing that information and not creating an environment where people would be fearful. And that's a balance that we're doing, but those are all great suggestions, and we'll work with communications.
Okay.
Dr. Anderson, if I could say, I am actively working with our communications office in addition to look at putting out a personal video from me to our community and staff. I've done that 1 or 2 times since I've been here, one of them on boundaries, where there was confusion in the community and people needed to be reassured that the superintendent is in charge of daily operations and is taking care of the issues that are coming up, and we're looking at getting something out today.
Thank you.
Thank
I
you.
think that would go a long way. My second question is regarding the long-distance learning. I'm particularly concerned regarding further providing a divide in terms of schools and students and families that have access and don't have access. So I like the fact that I'm hearing conversation that we will be checking out existing school devices. My follow-up to that is, do we have enough to go around, and how are we training parents who have never used MiFi to access that if we get to that stage?
We have enough, well, we certainly have a surplus right now of MiFis. We have about 100 that have not been checked out. So we believe we do. We can order more if we need to. We have been advertising it to families, but again, we don't necessarily know if there's unmet need out there, but we've been out reminding our schools that those are available. If the school is closed, we will have enough devices to issue. Again, we wouldn't be issuing them to every student, elementary and middle, just those that do not have a device available at home. So we believe we would have enough for that population.
Okay, thank you. And also, just, this is not a question, just something to put out there. I worry a little bit in terms of our younger students being able to access digital instruction. I'm talking about our kindergartners. And I didn't hear that there would be any accommodations for preschool, so I'm assuming they would not be part of this conversation for digital instruction.
Yeah, so again, we're looking at this kind of differentiated by grade level, right? So obviously at the high school level, students have devices, they have virtual learning environments in most of their classes, if not all of their classes, can be more self-directed and responsible. We need to get the materials out, so we would get learning materials out virtually, but it wouldn't necessarily mean that you're receiving virtual instruction. So the learning activities might be with textbooks, might be with other learning resources, but we do need to deliver the information and get that out virtually.
Okay.
But
I just wanna make
differentiated
su-
by grade levels.
Thank you. So long as there's equity, because I would hate for parts of our county to be able to receive these services and for other parts to be limited in terms of what they're able to receive. My next question is regarding attendance. I appreciate the scenarios regarding the recording of attendance for scenarios 1 and 2. My question is regarding parents who, let's say their child does not have a health issue, there's no health issue at the school, so there's no short-term or long-term closure pending, but for their own sake, they are determining that I am going to keep my child home. How is that attendance going to be recorded? Is it a normal absence because that's a parent choice?
So we have some of those situations, and we are encouraging parents to, of course, recognizing the fears that they might have, and encouraging parents to understand that we have no guidance from the CDC nor the health department at this time to remove students from schools. And those are really individual conversations that our principals are having with our parents. We, of course, want to have our students in schools as much as possible. And again, when we see instances or situations where parents are pulling their students out and they're not getting access to good instruction in schools, that our principals and administrators are working very closely with those parents to usher those students back in.
Okay, thank you. I also heard that you talked about whatever instruction will be provided is going to be language arts, math, science, and social studies, the core. My question is regarding the expectations for other teachers. What is their expectation regarding workload, whether this is packets that we take home and or digital online learning, if and when we get to that point?
So we're still working out some of those details. The subject areas that I was discussing were with respect to phase 1 of the plan, which would be, under the current plan, is developed the first 5 days of school, where centrally the Instructional Services Department and Department of Special Services would populate materials that students could use and could access, but would not be required, would not be graded. In phase 2, then teachers would be providing virtual instruction, and those materials and assignments would be broader than those subject areas that I mentioned. So not everything is probably going to be available and accessible, but we're working hard to make sure that if a student is receiving instruction in a particular area, we would find a way in an extended school closure during phase 2 of the plan to get those materials and that instruction provided to students.
Thank you. I do want to take my last 25 seconds to say thank you for all of the work that you've been doing. I know you guys have been literally working around the clock to make this happen. So thank you, Dr. Braybrand and the team. And the last thing, and it's not under your purview, but it's still a question. If school closures were to happen for whatever number of days it is, how does that impact SAC? I know it's not us, but I'd like to have that conversation.
And we can certainly get some information, but if our schools are closed, then SAC within that particular building would be closed while the school is closed. And again, we're looking at 2 different scenarios, but without having the county here, I wouldn't know what other options there might be for students attending SAC, but that will be part of the conversation that we're having this Friday.
We're meeting with SAC officials this Friday. That's the biggest nugget I want to share with you. We know SAC is a big question for our community, and we'll be meeting with them this Friday.
Okay, just again, a time check, folks. We have 5 members who'd like to ask questions, so if you could please be sure to ask something that hasn't been already asked, that would be great. And we'll shoot for 12:50 to have our next steps portion before we wrap. So Ms. Tolan, followed by Ms. Derenak Kofax.
Thank you. I just wanted to make a comment on the practice days. Again, I know that they were originally kind of set up for teacher instruction, but I know there are a number of corporations around the country, national corporations that are much smaller than 28,000 employees and 200,000 users that have already had practice days just to see if their employees can work from home productively. So just if we're going to do something like that, to make sure we take advantage of not just training the teachers, but making sure, our IT staff has everything working properly, the operations staff, et cetera, that we take advantage of that time across the district. I did want to ask a question about, there's been a lot of questions in the public about whatever you want to call non-essential activities, whether those are sporting events. We have a huge regional science fair coming up in a couple of weeks. I know that we don't have any direction to shut any of those things down at this point, but just wondering when or how those decisions might be made.
Well, as Mr. Smith said, we're continuing to use the health experts to really help us follow the guidance. We've also shared, and we want to reemphasize, and it was in the slides here, that parents absolutely have the authority to decide to ask their child and tell the school that they will not participate in an extracurricular activity, and we'll make sure that there's no penalty, for example, say the science fair, for not participating. But at this point, what we're really trying to do is lean on our health officials for expertise and balance the real concerns we have along with our duty and our expectation to provide instruction and education to our kids. And it's a careful balance, and that's what we're talking about today. And we need to recognize the concerns, and we need to recognize operational impacts, the equity issues that were raised, and the opportunities for kids to continue to participate. At this time, we've continued to have activities after school scheduled, and we're going to continue to use our health officials locally and CDC to help us moving forward.
Thank you. And then the only other point I wanted to make around communications is that if we aren't able to meet as a board, that we have some methods and communication plans, maybe it's Red Apple 21 or something, to make sure that we continue our transparency.
On that note, I would share with you, even when schools have been closed before, school board has been able to continue operations. We've had essential staff come in to make sure the school board could continue to have open meetings. So I want to reassure you and the public that even if schools or the school system were to close temporarily, board work at the board's discretion could continue.
As the board chair, I will certainly make sure that we coordinate with all the members of the board and keep us operating as normally as possible. If there are any changes, then people will be certainly informed upfront, and we will be very transparent.
Okay, Ms. Derenak Kofax, followed by Ms. Keys-Gamarra.
Thank you. Dr. Thank you all for this presentation. I really appreciate it. I think this is extremely helpful and is evident of the weeks of work that you've been doing, even though we haven't had this type of meeting. You've been working with this with the health department and county officials. Dr. Presidio, on page 7, preparation, time period 1 and 2, and you talked days 1 to 2 days. You talked about that the reason you are considering that option is because teachers have never been asked to provide instructional time. Usually when you're off for a snow day, there is no instructional time provided. When do you think you would make that decision? And I think I am in favor of, if the situation evolves to the point where we're doing rolling closures or something like that, I think that's extremely important that we have the opportunity to plan for this. But I think it's extremely important that we talk to the parents about this, and so they understand. And but what's your time frame currently for this?
So we haven't established a time frame. I would say we have a meeting tomorrow morning with the full leadership team to kind of talk through the distance learning plan and get some additional feedback and make revisions to the plan. Obviously, it's very helpful to get the board's feedback today. What we've been doing in central office is preparing to be able to implement a plan such as this. So for example, we've been working on preparing the materials, the professional development experiences that we would provide to teachers if the school system decided to take a day or more for preparation activities. And as Ms. Tolan said, we're not just looking at teachers, we're looking at support staff in the buildings. For example, the T-specs obviously are very involved and would have some opportunities to think about device distribution, right? The communications from front office staff also would be very important. So currently what we've done is develop materials, resources that could be provided to staff during such a time. We've identified some days on the calendar based on other issues, state testing requirements and things of the like that could be potential days. We've looked for Fridays or Mondays, but we haven't made any decisions about doing that. We want to get the board's feedback and have further discussion with the leadership team tomorrow.
All right, so after you discuss it with the leadership team, Dr. Brabrand will bring it back to the board for us to discuss.
Sure. I would say, I would only add to say that if we were going to do something like the preparation, given the evolving nature of things, that we would want to be trying to do this prep day before spring break. So a Friday or Monday prior to spring break, to do it, to be honest with you.
Better clarity, yeah. And thank you, Dr. Presidio, for naming all those things. The one thing, too, I think you know this, but I will just mention it, as I have 3 IB schools, particularly for those seniors, and their time, you know, they're set, and we need to be able to, and I know IB teachers, at least at my daughter's school, they were constantly filming online videos and things like that outside of school hours, so they are able to do that. But yes, please.
No, that's a great point, and we are in conversation with the IB organization and the College Board around any flexibility for late testing. Again, they haven't made any policy decisions on that yet, but as this continues to be a evolving and national and international issue, obviously, we expect further guidance from those organizations as well. But right now, that's part of the reason for the distance learning plan, is to be able to ensure that students can continue to receive instruction for those types of tests, for state tests, for graduation requirements, and just for continuity of learning across the different grade levels.
Thank you. My second comment is about, and I am so appreciative of your looking for access to food for families when this happens. I am a little concerned about the distribution plan that's listed here that establishes pickup times. That seems to be in conflict with the self-quarantine issue. And I would like to know, maybe we need to have more conversation with the health department, or, I know lots of times there's the weekend meals, and I know that wouldn't suffice for 2 weeks, but maybe upping in access, upping things in our food pantries or things like that.
And to note, the notion of a self-quarantine is really for those individuals who might be self-quarantining based on guidance from the health department or the CDC. So there is that aspect of it. And of course, we would be looking at a situation where if we had to close a school, it may not be the situation where everyone in the school where there was a concern that they would be infected. So they would have the ability to come into our schools, get the food at a particular drop-off site without coming into the school and without being part of a mass or a large gathering. So those are all things we're considering. But thank you for the feedback, and we'll certainly take that into consideration.
All right, my third question is regarding the communication plan for families. I see at the front of our FCPS website, we have a Corona update. I think that's very good. You have dated information that you can click on. Will you, at this point, be providing more extensive information? Will it be daily? Will it be twice a week? I would like kind of parents to be able to know that they can go on twice a week, 3 times a week, whatever your choice is, but when will you kind of have that out?
We've stated that at a minimum, it will be weekly, and frankly, as events dictate, it will become as frequent as there's major developments to be able to share. That could become daily. Frankly, it could be multiple messages within a day, depending on the news that we have. But certainly a commitment to seeing something weekly. I believe we are already set up to have weekly meetings with our county health officials as part of the work that we're doing, and any updates that we get from them will also be included, but we'll update as frequently as necessary.
All right, and these next 2 items come under worst-case scenarios, but I think we have...
Ms. Kofek, I'm sorry, your time is up.
All right, I'd like to go back.
Okay, Ms. Keys-Gamarra, followed by Ms. Pekarsky.
Thank you. I'm going to start by responding to requests for teachers or family members asking about using snow days. And I just want to say, as one board member, I'm not in favor of using those up and then implementing the distance plan. My concern is that we don't know how long any closure would be. And so I would hate to use up our time and then try to figure something out. So I would also like for you guys to come up with a plan as to, I think that suffices, and I'd love to hear how other board members feel about that, but I just wanted to express that. With respect to regular updates, I would love to see Dr. Brabrand something like, this is where we are today, as of this date, this is where we are, this is what we've been able to implement, this is what's available, so that people understand that they're receiving updated information on a regular basis. I think others have covered that. And then the final comment I really want to make is regarding how we are coordinating with the county. I know there is the health department, but when I think about One Fairfax, I think it's much bigger than that. And I wonder if, to keep down anxiety in our community, whether there needs to be some sort of joint communication, so that, A, we're making sure that we're reaching all parts of the county and we're not just using our resources, but we're using everyone's resources, but also that we also are assuring people in using those resources to do that. So I'll stop there in case.
Well, quickly, I'd say I continue to work with the county executive regularly on all matters, including this. We talked over the weekend. We attended a joint press conference in the city of Fairfax together. And we can certainly look at additional joint communication. The county has had the primary point of contact to be the health department, and Dr. Gloria, we've been working very closely with her and her team. But we'll take in consideration how we can have a broader One Fairfax message around this issue.
I'm really thinking of using county resources as well as school resources to address this countywide
to get the
problem.
message out. Yep.
How can libraries help us? How can, is there something with respect to parks that we need to be considering across the board so that people in our community, I looked on their website, they've got their message, Fairfax County, we have our messages, but I do think that if we come to the point where we start shutting down, we're going to need to be able to have that unified voice.
Understood.
As well as where the resources are across the board.
Understood. Thank you.
Okay, next, Ms. Pekarsky, followed by Ms. McLaughlin.
Thank you for all of these thoughtful questions and to staff for being proactive. Our parents in our community really deserve proactive communication, and I appreciate everything you've done, Dr. Brabrand, so far to get the word out. I'm still a little bit concerned about how we communicate with our families who do not speak English as their primary language. I know it's on the website, but I want to make sure that we're being proactive in using our liaisons, our teachers to push this information out, so that, because it is evolving and could possibly evolve very quickly, the changes. So that is, I guess, more of a comment I know was brought up before. I worry a little bit about the distance learning being something we've never done before. Of course, I want to make sure our students have access, our families have access, but when we start to talk about this required portion of it, something that has never been done before, our teachers haven't done, we know our students have differing levels of parental involvement or ability to be involved. We could potentially have parents who are sick. I want us to be mindful of that, and I think that is an ongoing conversation. I'd like to know if the PTAs are involved in this, and how our parents are being looped into this conversation. If you want to.
So we haven't formally shared the distance learning plan prior to today. We have discussed the need to confer with other stakeholder groups like parent-teacher associations, teacher associations, for example. We've had some preliminary discussions with principals, but there's a lot of additional communication that needs to happen. There's no question. I don't think anybody is under the illusion that this would be smooth or perfect, right? But we do recognize that I think it's going to be a community expectation that continuity of learning be provided by the school system in the event of an extended closure. So we're trying to come up with the best plan that we can that addresses all of those equity considerations that I think have been articulated really well around the table today. And we'll continue to look at those and continue to provide updates to the board about what is happening, should we have to implement a plan like this, and continue to work to improve it as best we can. So that's really our commitment, is to make sure that we are addressing to the best of our ability those equity issues that are so important.
Thank you, I appreciate that. And something that I have heard from my community in regards to the MiFi, there are still parents who don't know that that is something that is an option for them. So I would just like to put that out there, especially right now as we're kind of doing some of this preparation. Also, who exactly is monitoring these call-in lines when students are calling in, parents calling in with symptoms if they're absent?
So currently, school-based staff are monitoring the call-in lines, and if there are any spikes, we work very closely with the health department, and a lot of that information is shared within health department databases. That's how our health department identifies where we have health concerns when we're not talking about COVID-19, when we're talking about other health concerns. So that's really at each school, and working very closely with our clinic aides in our schools and working very closely with our nurses.
So our staff in schools, there's been communication with them and an expectation that they will communicate those symptoms if they start to see some of these at their individual schools?
Yes, so information, actually, this is all happening very quickly, and so information is going out today from the health department and from Fairfax County Public Schools on what to do if you have a student or a staff member who is exhibiting certain symptoms, and then how we would accommodate those individuals within a building and what the next steps are.
Perfect, thank you. And the last thing I wanted to just give an opportunity to you, Dr. Brabrand, if you would not mind, in this forum, very clearly to answer the question that many of us have gotten in email about why not close schools today? Why aren't we doing this preemptively?
Because our health officials, who we rely on for the expertise, this is a health challenge. We're relying on them to help us make the best decisions for student safety. I know a lot of people are anxious about the coronavirus. We face other viruses like the flu currently, where we have millions of people who are infected and thousands of people who die each year. And that is not to minimize the coronavirus outbreak and the seriousness of it, but we have other health challenges that we have managed short of canceling schools. And we need to be very, very careful as we make decisions that we are properly balancing the risk to our students, staff, and our community as we look at that on balance of other risks that are already currently out there and that we currently manage. We currently do not screen away students or staff who do not take flu shots. We encourage them. We offer them free here at Gatehouse. But we do not have that as a requirement, and the flu kills thousands of people each year in our country. So we have to do more, not only in getting the message out, as multiple board members have said, but we have to continue to let our health professionals give us the facts and use those facts and that guidance to serve us. I also want to say, as superintendent, to all of you and to the community, while closure is certainly a consideration, it is not the preferred consideration that any of us have. Instruction not based in the classroom in front of a teacher, any other instruction, while we will do every effort to make that a positive experience, still falls short of a classroom experience. I think all of us know that and feel that, but we have to do our due diligence in planning for worst case scenarios, but hoping for a focus, as Mr. Smith said earlier, that the health department has said, which is containment and mitigation. Containment to minimize it, so if we have an outbreak, we would do a temporary closure where we could do deep cleaning of the school, or mitigation when we do get some community spread that we need to have a period of time. And again, right now, health department guidance has been self-quarantine for those individuals, but where we would, in a sense, self-quarantine a school by closing it for 2 weeks. Long-term school closure remains a last resort for Fairfax County Public Schools. But we need to be honest that we're looking at all considerations as the situation evolves, and we'll use our health experts to guide us.
Okay, Ms. McLaughlin, followed by Ms. Corbett Sanders.
Well, it's perfect, coming right behind Dr. Brabrand, because I made notes that I wanted to reference why putting this into context matters. And as you were referencing, Dr. Brabrand, 32 million people in the United States so far have gotten the influenza, and we've had over 18,000 people die from it. It's significant. So it doesn't minimize how globally people are very concerned about the more lethal and highly contagious nature of the coronavirus is, and I'm proud of this board and the division and your work on this to be as proactive as possible, and so I'm not going to repeat what others have said. But I do want to say that I think that we have an opportunity here to really emulate and put into place what Portrait of a Graduate is and what a caring culture is. And what I mean by that is when we talk about the influenza and the impact every year, a lot of us have taken for granted what it means for good public health and hygiene. Hand washing. I mean, I have heard from parents for more than 18 years when I was a parent, we didn't build in enough time for that to happen. Well, this scary global virus has certainly caused us all to start thinking about basic lifelong public health and hygiene. So I would like that this isn't a reaction just to the coronavirus. It's a wake-up call for what do we do to help our employees and students be healthy every single year, to proactively start training our families about why the flu vaccine matters. I grew up in California and never had it. It just, I don't know if it's a California thing or just me, but so as a result, it's not in my nature to do the flu vaccine, but I've lived on the East Coast that it seems like it's a big deal. So let's be teachers to our families and our communities on the flu vaccine, on the proper hand washing hygiene. Parents and teachers tell us all the time kids are germ factories. That's just the nature of kids. And typically they get really sick in their early years at the elementary school level till their immune system builds up. So this is, again, an opportunity for us. So I'd like to emphasize that. Carl, what you talked about, and Rachna, you echoed it. It's so important that we also be mindful as global citizens, the anti-stigma messaging that the CDC has produced, and I emailed it to the board because a constituent sent it to me. I know it's on our website. Lucy Caldwell in Communications did a fantastic job immediately uploading it on Friday. But I would really like Dr. Brabrand as a next step that the board give you guidance and encouragement to go to all of our principals to really talk about what this means for not just the posters that are going to be there about hand washing, but all of the things, including the anti-stigma messaging. This is how we use this opportunity to teach our children about very real things that happen in the world, but in a positive, impactful way. And my time is now up.
Thank you, Ms. McLaughlin. Ms. Corbett-Sanders, and then I'll offer my remarks.
Great, thank you. And thank you for the briefing. I think this is an excellent briefing. The one thing that I think is really important for people to know is that this briefing is 10 years in the making, that there has been a plan that has been a collaborative plan between the Fairfax County government, including the health department, and FCPS for 10 years in response to the H1N1 virus that came out right in the 2009-2010. As we do everything, we refresh and we retool based on the situation analysis at that given time. But I want to reassure everybody in the public that this is something that we've got this. We know how to do many of these pieces. There are some areas that we are charting new ground, and in those areas of charting new ground, that's where we get our questions and some suggestions by the board members around this table. And it's also something that we need to assure the public that this is a collaborative effort at all levels of government, and that includes at the state level and at the local level, and obviously we would like increased collaboration at the federal level as well. And so along those lines, I do have a couple of questions or comments. One is I'm very concerned about the mental health aspect of this, because all of the conversations that are out there in the public have an impact, a jarring impact on our students, our families, and our staff. And so I want to make sure that as we build our plans out, that we do have the social emotional supports available to everybody involved. And some of them may be virtual and some may be one-on-one. Secondly, on the professional development, I do fully support the concept of taking 1 to 2 days and closing school and doing professional development. And the reason I do this is because it's not only to be prepared for the situation that may, in the most draconian of circumstances, close all of our schools, but it's also very important professional development to allow our teams to be able to support if a single school's closed, or frankly, it's just really retooling our 21st century skills. We then talk about the access to broadband, and this is a very serious concern of mine. I would suggest that we look at buses and being able to park them in some of our needier areas and providing a broadband access through that. And then I very much appreciated Dr. Anderson's comments about making sure we telephone, but I think we need to not only telephone out to families to bring them in and make sure that they are aware of what's happening, but we should be using all mediums, including telephone, text, tweet, Facebook, anything to get the message out, and partnering with the county on their Channel 16, as well as local media sources. And with that, my time is up, so thank you.
So I want to echo the opportunity about how we can use this as a learning opportunity, and by no means am I dismissing the very real dangers that may face us, but for myself with 2 young children who before this was constantly asking them to wash their hands, it is very stressful. And, you know, I just served on our calendar committee for the last few weeks, and one of the criteria that came out through that was building in time in each month for students especially to have a day off, to have time to regroup, and not only students but staff. And so this could be a way that we start to practice that and give people time. I am in favor of time to do professional development. I'm also in favor of just having that time, if it's a snow day here or there, used that gives people a chance to rest. I mean, sleep, it's so basic, but we know that we ignore it. That's why we're interested in the middle school start times. You know, can we just get back to these very basic things and prioritize that? So I think that focusing on the mental health care is really important. And so as a employer, but also as a system that educates. So thank you for considering that. So we have 2 go-backs. Excuse me? Okay, so let's just limit our go-backs to just 1 minute, please, so we can wrap by 1. So Ms. Darnett Koufax and then Ms. Keys Gamara. Thank you. Oh, you don't have another one? Okay, then just.
Does the county have a risk level assessment, like low, medium, high?
I'm not aware of a risk level assessment with regard to the coronavirus. When we talk about the levels of risk, when we talk about countries in the CDC, there is a level of risk. When I talked about that particular level 1, level 2, and level 3, that's an internal for us as we prioritize the needs based on feedback that we're hearing and those issues that need to take up more of our time or things that we can look at in smaller groups.
I only suggest that maybe that be part of the discussion. I know my daughter goes to school in the city, New York City, and they have that risk on her college website, what the risk is at this moment in the city. Second thing is, do you need any guidance from us today? Like, were there any questions that we didn't answer for you before you proceed?
Well, we certainly do appreciate the opportunity to share our plan with you and the feedback that we've gotten around the table. We've gotten some very good takeaways, and so other than utilizing you as part of our communication plan, providing the tools that you need as you're interfacing daily with members of the community who are asking questions, and ensuring that you have the confidence in those communications to either answer questions or to redirect to Fairfax County Schools or to the health department. So we just want to make sure that you have what you need moving forward.
I would just add, we did bring a nugget today that we are considering in this plan, a preparation of 1 to 2 days. I'd love to get a sense of the board, if the majority of the board would support that as a potential option as we continue planning. We would, of course, notify the board in advance and the community in advance of a date or 2 dates to do this. But I'd love to get a sense of the board. That is something that we have on the table for consideration, and would love to get a sense of the board.
Okay, Ms. Marin, if you can take a pulse of the board in a moment after I finish this. And then my last thing just speaks to our board work. We absolutely need to continue our work as a school board. I don't want to put staff at risk, and that's what I was starting down my road, the worst-case scenario. We are not allowed to meet remotely, which is kind of a silly thing in today's technological era. So I don't know, Madam Chair, maybe we need to work on that and talk to the State Department of Ed, state legislators.
It's my understanding that there is some flexibility based on emergency situations, and so what we can do is try to
We'll make sure our board has that information then, because I think that's the one thing. Well, we need to be secure in our governance structure. We also don't need to put staff and community at risk by attending our meetings. So I'm done. Thank you.
Mr. Foster is nodding in agreement, so I think we. have some flexibility. He's nodding.
Nodding in agreement means what, Mr. Foster?
Just briefly, there are provisions in the state code currently that do allow for remote meetings, but it requires a declaration of an emergency at the state level. And so I just wanted to make sure everybody understood that.
Thank you, that's important to know.
So we'll take a pulse on how the members feel about some amount of time being used to train staff, so closing schools and training staff. Can we just say, who is in favor of the staff using their expertise to determine if and when that kind of a closure is needed to train staff? Who would be okay with the staff, with our leadership team making that decision? Yes.
So the public didn't benefit from our closed session discussion. So before we vote on that, I just want to make sure it's on the table that some of us did express concern about the impact on working families. And so the request of the superintendent is to be very judicious. If it can be done in 1 day versus 2, we want that. I want to make sure the public knows we're not just, I heard what you said, Ms. Marin, about,
Yes, so we would-
rest and health, but I'm worried about working families
Yes,
too.
and as a working family, I too am concerned about that with my young children. So as we said, to leave it to trust our staff to make the best decision for our community. So who is in favor of letting our leadership team make decision if and when to close school, to do a training, to prepare for further education? Are there more questions about this?
Yes. Just one question, just to be sure, because.
Dr. Anderson.
Oh, I'm so sorry, I wasn't
but
recognized.
Ms.
so
Sizemore,
apologize.
Ms. Keys-Gamarra, and then you can take your turn. And we're going to limit these.
Yeah, I would agree as long as we take into account contingent plans to support our students that are more challenged around these, as well as the parent training piece that I mentioned, to use that time judiciously for both of that.
May I interject that we would entrust our staff encompassing all of the discussions we have had over the last hour and a half. I think that would apply to the decision that we're entrusting to our leadership team. Yes, Ms. Keys-Gamarra.
So I just want to make sure that as we're considering this, that we're also considering that as part of what we're communicating, because parents need to know now, say if we agree to this, that we're considering taking 2 days, 1 to 2 days of professional development, and that's the kind of up-to-date communications I think needs to happen in this very fluid situation. So I support it, but I think we need to let people know now, even if we have this vote.
So, Ms. Keys-Gamarra, we had discussed in advance, and I had briefed everybody in my notes last night, that we will be issuing from the board, from the school board, communications, a press statement, as well as possibly a video that reassures everybody of that.
No, that's not what I'm saying.
No, but goes through all of the things we're talking about.
That's fine, thank you.
Dr. Anderson.
I just want to be sure that we were going to be mindful of our staff who are also parents, and if they need to be able to attend to their children, just to make sure that we have that accommodation on this preparation day, in addition to making sure we're having conversations with our teacher groups, just to be sure that everybody is on board and we can have the most productive and effective transition possible. But as Megan said, I would definitely support this, but to be as judicious as possible, 1 day, because our working parents, it's really an issue.
Mr. Frisch.
Very quickly, just so that folks watching at home or online are aware, we've had extensive conversations about this in terms of our expectations, and that we're not just saying, go for it, do what you want to do. We've articulated, as Ms. Keys-Gamarra said, the need for making sure that the public has a full picture of what is entailed, that they would have some notice around these closures, and that this would not be done in a vacuum, that parents would be notified about the need for this and the plans for potential school closings that we're preparing for.
Okay, with that, all those in favor of allowing for the time to be set for this training in advance? Yes, thank you for the correction. Okay, so shall I count them off, or we're just a straw poll? Well, it's not unanimous. Okay. Is it unanimous? We're just taking a pulse. Okay, great. Well, thank you, Dr. Brabrand, for carrying out all of the ideas that we shared in your own plan. So with that, she doesn't. With that, we're going to adjust the agenda. We're going to take a break for,
Just any next steps.
so were there any next steps? I'm sorry, were there any next steps captured specifically? I know we had a lot of suggestions that it seems like, oh, here we go. Okay. All right.
One thing I don't know, again, just to put out, could staff just review these, and then if we have concerns, we can circle back to the board if there are any of these that we have concerns about, just given, I know you're trying to balance multiple things on your agenda today. We could look at them if we had any concerns to let you know. Just a suggestion.
Yeah, it's just to get.
Okay.
Mine's not. For accuracy and then.
Okay. You want to email that?
I'll go with the first one. Identify all employees who are not typically paid during school closures, e.g. bus drivers, custodians, cafeteria workers, et cetera, and determine the costs associated with paying these employees during any potential closures associated with COVID-19. Second, identify all hourly temporary staff who are not covered by the expanded administrative leave policies for those quarantined or ill with COVID-19 and determine the costs associated with including them in such a situation. Third, give guidance to superintendent to talk to principals about anti-stigma messaging, and that's where we need additional language.
Right, it needed to say, to talk with principals about proactive communication related to public health and hygiene practices for students. And
As well as anti-stigma. Stigma. 4, develop parent-family training to help families support distance learning with translations in varied languages. 5, ensure Phase 2 has plans for staff to help students who may not be as adept at catch-up from Phase 1. May not be as adept at self-directed learning.
Apologize. May not be as adept at self-directed learning or need catch-up.
6, proactive communication to community in varied forms of communications. Can we suggest your 6 being proactive communication to community should utilize all possible medium?
after community
To
should use.
all available medium. 7, plan for asynchronous and synchronous learning, i.e. organizational and executive functioning challenges in Phase 1 and 2 for English language learners, SWD, students with disabilities, and other populations who may need more supports. 8, consider developing a One Fairfax approach to communications that includes reaching diverse communities through both county and FCPS resources. And Ms. Picarsi.
Forgive me, I just need to understand. So these are next steps in that we are asking staff to bring this back to us, or?
This is more direction to the superintendent. He's not going to come back except for the financially impacting ones. I think that they're guidance to the superintendent.
Okay, well, I just want to make sure that we're all on the same page and clear about that.
Dr. Anderson?
Just one more next step regarding the if we get to that stage, but at least having a plan for the sharing of the checking out of computers and access to MiFi for families and parents.
Can I add to that? And
Absolutely.
possibly providing other sources such as broadband, utilizing buses in our neighborhoods that have less access to broadband.
I was just going to say, currently at this time, we don't have those when we explored looking at that as a possible opportunity. Now, I don't know if one of those MiFis can work inside of a bus, but that would be up to Mary Beth to.
Perhaps we could say as such as potentially providing broadband on buses, because I know that some of the wireless providers do have that capability. The only thing that is not on here is the mental health supports, and if I can just ask that we ensure that we are making our community aware of the mental health supports available to our students and staff to address the anxiety and concerns that they have.
Okay, I think that captures them all, yes? Okay, so as far as the agenda, what we'd like to do is take a 5-minute break here and then reconvene, only to go over to have the boundary study portion of the agenda, and we're going to shorten that. We'd like to do it in 15 minutes. It's a pretty procedural thing here, and we did something similar just 2 weeks ago at a meeting, and then we'd move the third quarter budget review. That is what is going to have to come off the agenda for today, and then we would adjourn at 1:30 to move on to other planned activities. So let's have a 5-minute break and reconvene at 1:15, please. Thank you.